Today, I will teach you how to properly brush your teeth. Make sure that the toothbrush that we use are soft bristled toothbrushes, and at the same time, find a toothbrush that has a tapering end to make sure and allow yourself to move the toothbrush in your mouth. Here is one of the brands of toothbrushes called Curaprox from Switzerland. They call it the Rolex toothbrush. If you look at the toothbrush in itself, it's a model toothbrush, not the real toothbrush to begin with. The toothbrush is beveled, or it's angled on the edges, which gives you the 45-degree angle of how you brush your teeth between the gum and the tooth. At the same time, what we usually tell or teach our patients is to make sure not to hold the toothbrush as if you are holding a spoon or a fork or a knife, but hold it like a chopstick or a pen, so that you are prevented from adding pressure onto your toothbrush when you brush your teeth and your gum. This is a typodont that represents our mouth, and what I usually do is I start in front and make sure that the bristles are in between the gum and your teeth on a 45-degree angle. So this bevel should be parallel to the floor or to the roof, and to make sure you have that, and you try to feel it where the bevel is. What we do is we start scrubbing what we call the Bass technique, or the modified Bass technique, wherein you go in circles between the gum and the tooth, just like that, and you go towards the back. And as you can see, as soon as we start scrubbing in circular motion, we tend to sweep from the gum downward. Just imagine the bristles entering between the space between the gum and the tooth, which allows the bristles to enter. And when you scrub in circles, and at the end of the scrubbing, you sweep from the gum towards your teeth. And that's what we call the modified Bass technique. We do it in all 4 quadrants. You know, if you can see, we can divide our mouth into 4: your upper right, your upper left, your lower left, and your lower right. So always have a technique to start from the right towards the left, and then you work your way down, and from the left towards your right. We always remind our patients to make sure not to forget the tongue side, where it's more challenging and more difficult, especially on the edges. So if you look at the way it should be brushed, now you still go on circles on a 45-degree angle, looking or towards the gum area. And as you approach the front part of your teeth, called the incisors, is you try to be careful and making sure that every single angle, especially in the canine area where it is quite challenging, and a lot of these patients tend to miss that part. So it's always good to double check your angulation to make sure that everything is thoroughly clean. In the end, the way we check whether your teeth are well cleaned is you always try to rub your tongue against the surfaces of your teeth to make sure that everything would be as smooth as glass, and it doesn't feel any furry areas. No, that furry part would be plaque that has been retained. Always remember to brush your teeth at least twice in a day for 2 minutes, and always floss before you brush. And don't forget to brush your tongue as well. Thank you.